New tonight, according to the CDC, 1 in 3 people with food allergies report having a reaction in a restaurant. But two Allegheny County state lawmakers are trying to advance a bill to require allergy warnings for customers and employees at restaurants. And the state house could vote on it as soon as tomorrow. I spoke with the only physician in the state legislature who's hoping the bill becomes law and prevents serious trips to the emergency room. If you're one of the more than 33 million Americans who has a food allergy, you know how a sudden allergic reaction can quickly ruin a night out to eat.
Food allergies are epidemic in our community. Nearly half of the food allergy exposures that result in emergency department visits are from restaurants.
A piece of legislation on the table in Harrisburg aims to minimize those risks. State Representative Arvind Venkat is an emergency physician with Allegheny Health Network who has seen people end up in intensive care because of food allergens. He sponsored House Bill 77 with Representative Natalie Mihalik. The bill would order restaurants and other food establishments to display food allergen warnings on menus and add allergy awareness posters in food prep areas.
So that customers are aware of the possibility of exposure to food allergens, that they can notify their servers or whoever's selling them their food about whatever food allergies they may have, as well as to make sure that in food preparation, people are well aware of the dangers of cross-contamination.
The legislation would also require food allergy safety training for restaurant employees. Venkat says he introduced the bill after he spoke with a Franklin Park mother whose son died from exposure to peanuts at a restaurant.
I have treated more than my share of food allergy patients. They can be quite critically ill, and it's something that I take very seriously, both as a physician as well as the representative in my community.
The State Department of Agriculture would oversee the program. Venkat says he believes restaurants are very aware of this issue, but more can be done to put people at ease and save lives.
Most food retail establishments, I think, are trying to do this. You know, I see menu notifications quite frequently, but whether that is also occurring in the food preparation areas and making it something that is done systematically is really important.
An earlier version of this food allergy bill passed the state house late in the last session and did not make it to the state Senate.